Hello, my name is Sophia LaRose, and today I'll be walking you through your employee benefits offered to you as a full-time salaried employee with Acme Finishing. Let's get into it.
Through United Healthcare's core network, there are 3 plans available to you to pick from, all of which are PPO plans, which offer you the freedom to receive care from doctors, specialists, and hospitals, both in and out of network. For the first PPO plan, you have a $0 individual deductible and a $0 family deductible in network. Out of network, you have a $1,000 individual deductible and a $2,000 family deductible. A deductible is the amount you pay for healthcare before coinsurance kicks in. But since there's a $0 deductible attached to this plan and network, your coinsurance immediately kicks in. This means that United Healthcare will be responsible for paying 90% of your qualified health expenses in network, and you'll be responsible to pay the remaining 10% of the expense. If you are seeking care that is considered out of network, you will be responsible for paying 50% of the expense. So that's why we always recommend checking to see if your care is considered in network. After I finish reviewing this plan, as well as the other 2 PPO plans, I will share with you how you can look up your provider. In network, your individual out-of-pocket cost is $4,000. Out-of-pocket costs typically include deductibles, coinsurance, and copayments for covered services. But since there is no deductible under this plan, your out-of-pocket costs will only consist of coinsurance and copayments. Once you have met your out-of-pocket costs of $4,000, United Healthcare will pay 100% of your health expenses. For a family plan, there's an $8,000 deductible before 100% of your expenses are covered for the entire family. In the case where you're on a family plan and you have individually met your $4,000 out-of-pocket maximum, $4,000 will contribute to your family out-of-pocket maximum of $8,000. However, that is the most you can individually contribute to the family out-of-pocket cost. So other family members' copayments and coinsurance expenses will have to fill the remainder of the out-of-pocket maximum of $8,000 in order for 100% of your expenses to be covered by UHC. Moving down to physician services, all preventative services are covered at 100%, including many screenings like mammograms and colonoscopies, counseling on various topics, routine vaccinations, and more. Telemedicine visits are 100% covered through a network of physicians ready to diagnose, treat, and prescribe medicine over the phone 24/7, 365 days a year. Your primary care physician and specialty doctor appointments will both have a $15 copay. Any x-rays, lab work, MRIs, and other advanced imaging expenses will be covered 90% by UHC, so you'll be responsible for 10% of the expense. For example, if an x-ray costs $1,000 and you have yet to meet your out-of-pocket maximum of $4,000, United Healthcare will pay $900 and you'll be responsible to pay $100. If you ever find yourself in the emergency room, there will be a $300 copay, and then you'll have to pay 10% of any additional expenses during your visit. You will notice the copay attached to an urgent care visit is $100. So if you can go to urgent care before the emergency room, we recommend you do so. If you're admitted into the hospital, there will be a $750 copay on top of paying 10% of the expense until you've met your out-of-pocket maximum. Lastly, if you ever need prescription drugs to be picked up from the pharmacy, we recommend that you look at the prescription drug list on myuhc.com, call the number on your health plan ID card, or reach out to Marsh McLennan Agency's Benefit Advocate Services to see which copay is attached to your medicine. The contact information for your Benefits Advocacy Service is at the end of your Benefit Summary Guide packet.
For the second and third plan, I decided to put them next to each other to speak about them simultaneously, but I'll make sure to speak on the differences between the 2 plans, which are highlighted in yellow. Starting with plan number 2, there's a $500 individual deductible for in-network benefits and a $1,000 deductible out of network. For a family plan, there's a $1,000 in-network deductible and a $2,000 out of network deductible. Looking at plan number 3 on the right, you'll see that there's a $2,000 individual deductible in network and a $4,000 deductible out of network. For a family plan, there's a $4,000 in network and $8,000 out of network deductible. Once you've met your deductibles, United Healthcare will pay 100% of your expenses in-network and 50% of your expenses out-of-network, which is your coinsurance. For plan number 2, the out-of-pocket cost is $3,000 for individuals and $6,000 for family plans in-network, which includes your deductible, coinsurance, and copayment expenses. For plan number 3, there's a $4,000 individual out-of-pocket cost and an $8,000 family out-of-pocket cost, like the first plan we went over. Similarly to the first plan, 100% of your preventative services as well as your telemedicine appointments are covered. A primary care appointment has a $25 copay, and a specialist appointment has a $75 copay. Any lab work or imaging will be covered at 100% by UHC. You will notice that ER visits as well as inpatient hospital stays will both be a $300 copay, whereas urgent care visits will be $50 copay compared to $100 on the first plan. Lastly, for your RX benefit, you will notice that copays are the same between the first and second plan, but are a bit higher for the third plan. As a reminder, we recommend that you double check which tier your medicine falls into before picking it up at the pharmacy.
In order to figure out if your care is considered in-network versus out-of-network, we recommend that you go to www.myuhc.com, log into your account, and look up your doctor. If you don't have an account set up yet, you may go to www.uhc.com, click Find a Doctor, and continue your search as a guest. You can use the same process to figure out how to get the best price on your prescriptions as well. Now, I would love to take a moment to recap some things I've mentioned on ways to save money while utilizing your benefits. For preventative services, this includes one physical exam per year, so make sure your provider doesn't tag the service as a diagnostic appointment, rather labels it as a preventative service so that it is paid 100% by United Healthcare. For prescription medicine, ask your doctor if there is a generic version of the medication they're prescribing you, so you can ensure you are getting the best price. Additionally, use outside resources like GoodRx to see if you can get medicine shipped to you for cheaper than making a trip to your local pharmacy. And as mentioned earlier, you may either log into your UHC account or call the number on the back of your ID card to find information about your medication, pricing, and low-cost options. For x-rays, lab work, and advanced imaging appointments like MRIs and CT scans, they will cost 2 to 3 more times at a hospital than in an in-network imaging center. So try to find a freestanding imaging center to do your imaging or run labs for you in order to save a substantial amount of money. Lastly, we would like to remind you that you have multiple avenues to receive care. For routine checkups and symptoms that may not feel extreme, go to your primary care doctor. There are also convenient clinics like CVS and Walgreens if you are unable to get an appointment with your primary care doctor. Urgent care visits will either cost you $50 to $100 depending on which plan you elect coverage for, and is less costly than going to the emergency room. But in the case of an emergency, please go to your nearest emergency room to get treatment. As a member of United Healthcare, there are additional value adds for you to take advantage of at no extra cost to you. There's a wellness program where you can earn up to $1,000 in rewards for reaching your program goals and completing activities. To get started, you may download the UHC app or go select UHC rewards in your UHC account online to activate it. You can gain rewards by tracking nights of sleep, amount of steps per day, taking a health survey, and more. Secondly, Healthiest You is a platform where you can talk to medical doctors who can diagnose, treat, and prescribe you medicine 24/7, 365 days a year. You can also communicate with a dermatologist through the Healthiest You app, connect with a therapist to support you for anxiety, stress, depression, or other mental health needs, and even get help to relieve neck and back pain through guided videos with a certified health coach. Lastly, you have the ability to see a doctor 24/7 with virtual visits through your UHC account online or via the UHC app. Here is a snapshot of what it would cost you per health plan per paycheck, along with what it would cost you if you had a spouse, dependent, or complete family electing for coverage under one of Acme Finishing's plans. You can also find these rates within your benefit summary packet. Now we will dive into your dental plan options. On the left, you will see a dental HMO plan. A typical dental HMO plan doesn't require any deductibles or maximums. Instead, you'll pay a fixed dollar amount based off of a predetermined fee between United Healthcare and your dentist. So before you go to your local dentist, ensure that your dentist is considered within your HMO network. If you decide to elect for the HMO network, know that there is a 15-page copay summary that can be obtained from your HR department. For the PPO plan, a part of the National Options PPO 20 network, it covers preventative services at 100%, like x-rays one time per year and annual cleanings twice a year. It covers basic services like fillings and simple extractions at 80%, and lastly, major services like root canals, crowns, and dentures will be covered at 50%. You have a $1,000 calendar maximum attached to the plan, which means that United Healthcare will pay its portion of your bill up to $1,000 for any covered dental services received. If you have any questions regarding your provider and if it is considered a network or not, please feel free to reach out to your benefit advocates team to assist you. Here, you will see a snapshot of what it will cost you per paycheck if you decide to elect for the HMO plan versus the PPO plan. Please refer to your benefit summary guide where the costs are listed as well. Next, let's talk about your vision insurance. The vision plan offers an annual eye exam at a $10 copay. If you need glasses, it'll be a $25 copay, and you are eligible for new lenses every 12 months. If you need new frames, you are eligible to get them every 2 years, which has a $130 allowance, and anything above that is 20% discounted. Lastly, if you wear contacts in lieu of glasses, you have a $130 allowance every 12 months. Similarly to medical and dental networks, by accessing your in-network vision providers with VSP, you will reap the maximum benefits of vision insurance coverage. VSP's network is very strong and robust, but always double check to ensure your provider is considered in-network. On the right, you will see a snapshot of the weekly contributions for vision plans. At no cost to you, you get a $50,000 life benefit. Please ensure that you have a designated beneficiary to receive your life benefit in the event that you pass away from a covered accident or illness. In an event where you become dismembered due to a specific accident, such as a loss of a limb, paralysis, or eyesight, you can also receive a $50,000 accidental death and dismemberment benefit. If you need an additional life benefit, Acme Finishing offers a voluntary life benefit. All employees are eligible for up to $300,000 of coverage, sold in increments of $10,000. There is a guarantee issue amount for $100,000, and anything over that will require a statement of good health. Spouses are eligible for up to $100,000 of coverage and have a guarantee issue amount of $25,000. For children, they are eligible for a $1,000, $2,000, or $10,000 flat policy. And to remind you, employees are responsible to pay 100% of the policy amount, not Acme Finishing. Through Mutual of Omaha, you get short and long-term disability benefits completely paid for by your company. Short-term disability provides a source of income for short-term illness and injury that prevents you from working, and you will receive your benefits on the 8th day. You can receive up to 60% of your weekly earnings with a maximum benefit of $2,500 per week. Once the length of short-term disability reaches 12 weeks, your long-term disability benefit kicks in. You can receive up to $6,000 per month and will continue for 12 months. And to remind you, it is completely paid for by Acme Finishing. Here is our employee benefits claims advocacy service that's available to all Acme Finishing employees. If you have any questions or inquiries regarding bills received from providers, have denied claims that you need assistance with, finding in-network care, medication assistance, and more, feel free to reach us at the email or phone number below. This contact information is also in your benefit summary guide packet. What's the next step? If you're a new hire, you're eligible for benefits the first of the month following 60 days of employment. Once you become eligible for your benefits, please complete your new hire paperwork within 15 days of being eligible. If you are applying for additional voluntary life and accidental death and dismemberment benefits and it exceeds the guarantee issue amount of $100,000, you'll be required to complete a statement of good health. If you do not elect for coverage, your next opportunity to make changes to your existing coverage without a qualified life event, like getting married or having a baby, you'll not be able to enroll in coverage until the next open enrollment, which will be conducted in February of 2025. If you have any questions regarding your benefits, please reach out to Wendy Brandt or to your insurance broker, Sophia LaRose. Thank you so much for watching.